relative to the pandemic and COVID-19, we have, like the other 49 states, started moving in the wrong direction a few weeks ago. Clearly, this is attributable to two things. One is the emergence of and the growing prevalence of the Delta variant of COVID-19. And secondly, and this goes hand in hand with it, vaccination rates that remain woefully inadequate. Now, before we get into that, I did want to start with a little bit of good news. And you probably saw this, but we have had our first drawing for $100,000 scholarship and for a $100,000 cash prize via the Shot at a Million lottery. I was able to speak with both winners yesterday, and I want to congratulate them both again today. The $100,000 cash winner was Mr. Clement DeSala, an 82-year-old gentleman from New Orleans who was a 30-year veteran of the New Orleans Police Department. And I had a great conversation with him, and I wanted to congratulate him again on that. And I also want to congratulate him not just on winning, which was a matter of chance, but for making the decision to be vaccinated, which is something that was incredibly important for him and for his wife and his family. I also want to congratulate again the $100,000 college scholarship winner, Miss Scala DeGrasse from Hammond. She is a 17-year-old senior at Hammond High School. And I don't know whether she was more excited or her mother, Sandra, was more excited about that $100,000 scholarship that will be paid into a start account for Sandra. And she told me that as of now, she intends to stay at home and go to Southeastern Louisiana University. So I congratulate her and wish her nothing but the best. And like Mr. DeSala, I also thank her for the decision that she made to be vaccinated, which when you hear the rest of the presentation that I have for you this morning and the other speakers, I think you're going to see, if you haven't already, just how important it is that people make a decision to be vaccinated and that they do it soon. I would remind everybody you can be a winner too. If you get vaccinated, you can register at shotatamillion.com. The deadline for next week's drawing is tonight, precisely 11:59. You got to register today, so 12 o'clock is tomorrow. So you got to do it today. And then the drawing will be Wednesday, and then the announcement will be a week from today. Joining me today, again, is Dr. Catherine O'Neill, an infectious disease specialist at Our Lady of the Lake Hospital, Dr. Joe Cantor from the Department of Health, and Tyler Duplantis of the United Home Nation. Tyler was initially concerned and hesitant about getting vaccinated. He then decided not to rely on the information that he was being given by others and untrustworthy sources, and he did his own research into the issue and decided to be vaccinated for himself, but also for his family and for his community. And he's going to join us in a few minutes to share his story. And I do hope that folks out there across Louisiana will listen intently to the message that he is going to deliver, and that they will choose to do the same as he has, and that is to be vaccinated. As of yesterday, 50% of all adults in Louisiana, so 18 and above, have received at least one dose of the COVID vaccine. And as I mentioned, we're thankful for everybody who's decided to do that, but that's not high enough. There's not enough immunity across the state in the various communities that comprise our state to ward off transmission. And that's what we're seeing today. And the shame of it is we have 3 very safe and effective vaccines to combat the spread of COVID-19. But because people are not vaccinated in sufficient numbers, the number of new cases diagnosed each day in Louisiana has been increasing since June 16th, so for a month now. And the increases are in all regions of our state. So nobody should be out there thinking, well, that's a problem in another state or in another part of our state. This is happening everywhere in Louisiana. Dr. Cantor will show you some slides shortly. So suffice it to say, we are facing a very serious situation. Yesterday, you may have seen the U.S. Surgeon General who stated, and I think very accurately, that the misinformation out there about COVID vaccines is literally costing lives. And it's costing lives here in Louisiana as well. It's preventing people from getting the protection that they need for themselves, their families, their community. And when it comes to misinformation, not sharing it is caring for your neighbor. So I'm calling on people not to spread misinformation. In short, bad information about the COVID-19 vaccine is slowing our efforts to end the pandemic. Here in Louisiana, over the last 14 days, the number of COVID-19 cases has increased 167%. Hospitalizations throughout Louisiana have been increasing for the past 14 days, with 245 additional hospitalized patients added during that time. Over the last 2 to 3 weeks, we have lost more than 4 months of progress in our hospitalization numbers. If you go back to March 4th, you will see numbers that are right around today's number. And on March 4th, we had 554. Statewide percent positivity of new COVID-19 tests conducted currently is 6.3%. It's almost 3 times what it was just a few weeks ago. During the past week, there have been 35 new outbreaks and 200 new outbreak-related cases. And Joe will go over more of this in just a moment, but this represents a 169% increase in the number of reported outbreaks and a 96% increase in the number of outbreak-associated cases relative to just the previous week. So we know that the Delta variant is more transmissible, and it also has the potential to make those who contract it much sicker. For example, the average viral load is higher for COVID cases caused by the Delta variant than was the case prior to the emergence of the Delta variant. So no one should be under the misimpression that if you've already had COVID, that you have a level of protection that means that you don't need to be vaccinated. Protection conferred by disease is less robust and doesn't last as long as protection conferred by vaccination. And in fact, I will tell you, we have seen individuals in Louisiana who have now contracted COVID on 3 separate occasions. Since February, and I want people to listen to this very carefully. Since February of this year, 97% of cases and deaths have been in individuals who are not vaccinated. We know that well over 90% of all of our current cases, hospitalizations, and deaths, fully preventable. So, what do we have to do to fight back? It really is this simple. Roll up your sleeves and get vaccinated. There are 3 safe and effective vaccines: Pfizer, Moderna, and Johnson & Johnson. They provide great protection against the Delta variant as well as all of the other variants. And what we know is the more transmission of COVID-19, the more variants that will emerge. So the sooner we do this, the better off we're going to be, because we don't know how soon the next variants pop up and become prevalent and maybe even worse than the Delta. But we know that if we slow transmission through vaccination, that is much less likely to happen because you won't have as much transmission. So if you're listening to this today and you haven't yet taken the COVID-19 vaccine, I would encourage you to do it immediately. We have more than 1,400 locations spread across all 64 parishes in the state of Louisiana. You can go to covidvaccine.la.gov to find the location nearest you. You can go to vaccine.gov, and that's a federal website to give you the information. So at this time, I'm going to ask Tyler to come up and share some information with you. And then after Tyler comes up, I'm going to ask Dr. O'Neill to come up, and she's going to give you a glimpse into what the current situation is in the hospital community here in Louisiana. And of course, she's from Our Lady of the Lake here in Baton Rouge. Then Dr. Canner is going to come up, and I apologize, but there will be a lot of data given to you today. On the other side of Dr. Canner, I'll come back up, wrap up my remarks, and then we will take some questions as well. So, Tyler?
Hi, everyone. So firstly, I'd like to thank the Department of Health and Governor Edwards for allowing me to speak with you all today about a very important topic, the COVID-19 vaccinations. So to start my story, I feel like I have to go back to the very beginning when all of our lives changed. In March of 2020, I was a senior at Nicholls State University. I was looking forward to graduation and looking forward to finally find a career in my degree. So by the Friday, there was just talks about our classes moving to online. But by Monday, it was all online. I would never be able to say goodbye to my classmates, and I would never be able to say goodbye to my professors. My sister, a senior in high school, would never be able to attend her marching band festival because of COVID-19. Our lives were changed forever. So by the summer, I was looking for a job because the job market, there was nothing open right now. The whole world shut down. But my tribe, the United Home Nation, was looking for a community outreach coordinator, and I definitely took that job offer. Starting off in that career, we were delivering to 500 households in 6 parishes food distributions for elders who are at risk when it comes to COVID-19. Throughout my time, because this is all new, lots of our phone calls that we were receiving each week was elders who have passed away from COVID-19. I would like to mention those are our culture bearers. Those are community members who hold on to a lot of our traditions. By then, I knew the severity of COVID-19. So when the vaccination came up and it was coming around to my age range, I had a lot of concerns because of the unknown. I was concerned with what's in it. I was concerned about the long-term effects. I was hearing from everyone, oh, it's rushed. You know, what's going to happen? So I like to learn. And one of the things about me is I like to ask questions. So instead of just hearing from social media and just asking around by people who are not in the professional environment, I ended up going to those direct sources that would provide me the facts about the COVID-19 vaccination. As I was doing so, I would ask them the same questions, and I always got the same answers. By then, I was more comfortable with taking the vaccination. Last year, we were not able to host our annual powwow. This powwow is a chance for the community to come together and to be able to learn more about our culture, to be able to introduce the kids to our culture. With the COVID-19 cases rising up drastically, again, I would love for us to all get vaccinated so that we can be able to host a powwow again, so that we can come together as a community. I'm not standing here telling you, you have to take the vaccination. I'm standing here telling you that if you do have concerns, don't just make the assumption, don't just say no. Ask those questions. Go to the professionals and ask them before you just make a decision, because I promise you the person next to you is asking those same questions. So you may be able to provide them with an answer. I would like to thank you all for listening to my story today, and I hope that we can finally reach a point where we reach over that 80% of vaccinations in Louisiana, because I don't know about y'all, but I'm ready for us to get back to normal. Thank you all so much.
Good morning. I'm here to give a brief update on how our hospitals look and our medical community looks, and also how Delta variant is affecting our community. I'd like to talk about Delta variant first because for me it's the newest thing and the most important difference that we are facing right now compared to last year. The Delta virus, the Delta variant, is not last year's virus, and it's become incredibly apparent to healthcare workers that we are dealing with a different beast. Last year, if you were infected with the virus, you had protection that lasted quite some time. That is no longer the case, and if you've been previously infected, you are not protected against Delta variant. Last year, kids didn't seem to spread this virus very much, and they didn't seem to get that sick from it. We didn't see this increase in our pediatric admissions, not that much. We saw some unfortunate cases, but overall we felt good about our kids. Delta variant is coming for our children. We are seeing increased admissions, we are seeing increased office visits, we are seeing sick kids and intubated kids today in our hospital. Last year, our pregnant mothers felt pretty good about Delta virus, about coronavirus. They didn't have vaccine, but they knew how to protect themselves, and our pregnancies looked okay. And this spring, our pregnant mothers are at risk. We're seeing them admitted, we're seeing them ventilated, and we're seeing the loss of their children. Delta variant is a different virus from last year, and we cannot take what we think we learned from last year's virus and apply it to this summer, because it's killing us. Why is it? Why is Delta variant so different? It's different for one main reason. When it gets into our body, it hides for a little bit. It's super smart because we let it figure out how to evade our immune system. And in my immune system as a vaccinated individual, and in your immune system possibly as an unvaccinated individual, it hides for a little while and it starts to spread before our immune system knows. So for me, I still feel good about that. That's fine. My immune system is ready. And within the first day after it's finished hiding, I have antibodies and I am fighting it. And so even if I become the rare breakthrough case, I am going to be mildly symptomatic, get a test, and get over it. For the unvaccinated, it's like letting a burglar cross all the way through your threshold, all the way into your bedroom, and wake you up from sleep before you know it's there. Delta variant is sneaky, it's a beast, and it has figured out why you are no longer that person who's going to be fine. It's killing us. What are we seeing in the hospitals today because of the Delta variant? What I saw earlier this week was just what we talked about last year. I had a hospital in North Louisiana call me with somebody who did not have coronavirus, who needed a specialist, a surgical specialist. They called 40 hospitals. They got told no by everybody. That patient sat in their ER waiting to have surgery, and they begged us, please find a bed for this young person who just needs a surgery to save their lives, because 40 people have told us no. And we're at the beginning of this surge. So what did we do? We shunted all of our activity in the hospital. We tried to free up as many beds as possible so that we can once again, every single day, try to protect those people who don't have COVID, while more and more COVID comes through the door. We're being overwhelmed, and it's happening really fast. What are we seeing with our COVID patients? When I look through our list every morning, it's my friends. It's my peers. They're 30 and they're 40 and their kids go to school with my kids, and their kids are starting college in 3 weeks and they're not going to be alive. It is us. It's not those people who are sicker. It's us. That's who's in the hospital today. And across the street are my friends' kids. That is what Delta variant is. It's coming for us. It's a beast. That's what we're seeing in the hospital. That's why we're nervous. That's why I'm here to talk to you today, because it's different. I want to be clear after seeing what we've seen the last 2 weeks. We only have two choices. We are either going to get vaccinated and end the pandemic, or we are going to accept death. A lot of it, this surge and another surge, and possibly another variant. That's it. It's no longer about what you heard on the news or what you think your hesitancy might be. If you don't choose the vaccine, you're choosing death. And you're choosing a surge and another surge. Pandemics last for years. We know that. We're very educated people. Pandemics last for years. The only thing that will stop them is the vaccination. Which one do you choose? I choose vaccination. I will sit in Tiger Stadium. I will watch our vaccinated team play a phenomenal game of football over and over again this year. But when I look in the front and the back of me, there will be people who are not there, people who I have high-fived for years walking up those stands. And it's not because they let their season tickets go. It's because they're not here.
Good morning. Tally, thank you so much for sharing your story. We really do appreciate it. And Dr. O'Neill, for those who have the pleasure of knowing Dr. O'Neill, as I've gotten to know her over the past few years, will know that she's not one prone to hyperbole. And I really hope that you listen to what she just said, because Dr. O'Neill and her colleagues are truly on the front lines of this right now. And, if you talk to people that work in hospitals right now, they'll tell you almost every hospital in the state, really a lot of hospitals across the country, are experiencing a nursing shortage. It's difficult to retain nurses. It's difficult to recruit new nurses. And a big reason for that is because it's been so traumatic being on the front lines this whole time. I think, as an ER doc myself, first I agree with every word that Dr. O'Neill said. And I think what is the biggest punch in the gut to me, as we embark on a surge right now, and make no mistake, we are embarking on a surge, the biggest punch to my gut is that this one is preventable. And communities, states, countries that have done a better job of vaccinating individuals will largely not experience this. But we've not been so fortunate here. I'm going to show you some data. I'm going to give you the bottom line up front right now, which is we are clearly in what is now our fourth surge. I cannot tell you how high or bad it's going to get. I cannot tell you how long it will last for, but the data is overwhelmingly conclusive that we are in a surge right now. And the underlying message to folks, beyond what the governor said, which is that we need more of our neighbors and friends to get vaccinated. The underlying message is that the risk out there to you is higher, significantly higher now in Louisiana than it was even 2 or 3 weeks ago. Let me go through some data real quick. The governor warned you it was going to be a lot of data, so I'll go quick through this. It's been a while since we've gone through these data points. I'm showing you the classic gating criteria slide that we look at. This is state as a whole. I am going to take you through each of the 9 regions quickly, but let me walk you through this. On the top left, you see a graph of what we call COVID-like illness. This is the number or the percent of all emergency department visits in the state that are attributable to COVID-like symptoms, people walking into ERs with cough, fever, shortness of breath type symptoms. On the top right, you see incidence. This is the number of new COVID diagnoses every day. Number of new cases reported to us in the Department of Health every day, smoothed out over a 7-day rolling average. On the bottom left, you see a combo graph. The orange bars on the bottom are percent positivity, so what percent of all tests being done on a given day or a given week, in this case, are positive for COVID. And the purple line above that is our testing volume, how many tests are being conducted across the state. On the bottom right is the hospital census graph, so how many COVID positive patients are currently in hospital beds being treated inpatient across the state. On the top right of there, you'll see clearly the first surge, the second surge, the third surge, which was our biggest to date over Christmas and New Year's, and now we have now been going up in new cases for the past 24 days in the state. On the bottom left, for percent positivity, I'll note that we have been below 5% positivity since the beginning of February, which has been tremendous. We did a really good job coming off of that winter surge of suppressing transmission down. And if there's any saving grace here, it's that we did such a good job lowering transmission in a state that we have a little bit of breathing room now that we wouldn't otherwise. But as Dr. O'Neill alluded to, that breathing room is evaporating pretty quickly. Percent positivity for the state over the past week has gone up from 4% to 6.3%, as the governor said. And on the bottom right, number of hospitalized COVID patients, we're at 563 today, hospitalized COVID patients throughout the state. That number has more than doubled in just about 2 weeks, just over 2 weeks time. And hospitals are busy already caring for other patients, a lot of RSV right now, and hospitals are having a tough time finding nurses and other staff to open up beds, to staff beds. That's causing a crunch right now. I'm going to go on to Region 1. I'm going to go quickly through all the regions here. Region 1, which is the greater New Orleans region. On the top right, you'll see cases have been increasing now for the past 21 days. Percent positivity on the bottom left has gone up more than double, from 2.2 to 4.5% in the last week. And there are now 87 patients hospitalized with COVID in Region 1. In Region 2, the greater New Orleans region, cases have been increasing for the past 31 days. Percent positivity this past week has gone up from 5.2 to 7.1%, and there are 88 patients hospitalized with COVID. In Region 3, the River Parishes region, cases have been going up consistently for the past 25 days. Percent positivity increased this past week from 5.8 to 9.2%, and there are 45 patients hospitalized with COVID. In Region 4, the greater Lafayette region, their cases have been going up for the past 24 days. Percent positivity increased this week from 4.6 to 6.7%, and there are 89 patients currently hospitalized. In Region 5, or the Lake Charles region, cases have been going up consistently for the past 16 days. Percent positivity went up this week 4.5% to 4.9%, and there are 31 patients hospitalized. In Region 6, the Alexandria region, cases have been going up consistently for the past 19 days. Percent positivity went up from 2.7 to 3.3%, and there are 32 patients currently hospitalized. In Region 7, or the Shreveport area, cases have gone up for the past 14 days consistently. Percent positivity went up from 3.9 to 4.1%. There are 68 patients hospitalized. In Region 8, or Northeast Louisiana, cases have gone up consistently for the past 23 days. Percent positivity went up from 3.3 to 6.1% in the past week. There are 28 patients hospitalized. And finally, in Region 9, the North Shore, cases have gone up consistently for 39 days. Percent positivity went up from 6 to now 11.4%. And there are 95 patients hospitalized, the largest number in the state right now. When we had looked at the chart that shows what each region looks like, the last time that we looked at this as a group was April 24th. And this is how it looked. You see a little bit of yellow, which is plateau. You see a little bit of red, which is increasing, a little bit of green, which is decreasing. This is COVID-like illness on the left, then cases, and then hospitalizations. I will say, after we showed this, it all improved from this graph. It all got down, and really since that time, up until a couple weeks ago, 2 or 3 weeks ago, we were looking very good, and there was much more green on this graph than there even is now. Please go to the next slide, and we'll show how this looked as of 2 days ago. Every single category is increasing. Statewide, all 9 regions. Cases are going up, COVID-like illness or ER visits are going up, and hospitalizations are going up. It is unmistakable that we are in a 4th surge now. If you look at cases, new cases by age group, that'll be the next slide. I want to point out a couple things here. We're seeing the sharpest increase in cases right now amongst younger individuals, amongst people 5 to 17 years old, 18 to 29 years old, and 30 to 39 years old. Maybe not on average getting as sick as older individuals, although as Dr. O'Neill said, Delta is changing that, but certainly contributing to the transmission. spreading the virus to other people, to their family, to neighbors, to coworkers. And I do expect each of these categories to get worse over the next coming weeks. Next slide, please. Go back one slide, please. As the governor has said, if you go back to the beginning of February, 97% of all cases of COVID and 97% of all COVID fatalities have been in individuals who are not yet fully vaccinated. That speaks volumes to what these vaccines do. And as Dr. O'Neill said, we are seeing a few breakthrough cases, a relatively small number of breakthrough cases. These are people who are fully vaccinated and still test positive for COVID. I'm going to give you those numbers right now, but I'm going to submit to you the exact same thing Dr. Neal did. By and large, when people have a breakthrough case, it's usually mild or asymptomatic because they have a head start on protection. Their body already has antibodies and other defenses. It may take a little bit of time to kick in, but they already have those defenses. When we see the worst complications, more often than not, and that's an understatement, it's individuals who are not yet fully vaccinated. To date, we are tracking 2,175 breakthrough cases. This is 0.1% of everyone in the state who's fully vaccinated. Of those cases, 125 individuals have been hospitalized with COVID. That's 0.008% of everyone who's fully vaccinated. And of them, 34 have died, or 0.002% of everyone who's fully vaccinated. To Dr. O'Neill's other point, the median age of serious breakthrough cases, and by serious I mean hospitalized or death, the median age of those individuals is 72. And that speaks to their risk from COVID and how we know vaccines work, which is the older you are, the less likely you are to mount as robust an immune response as somebody who's younger. By and large, breakthrough cases are rare, and the consequences of them are much, much more mild than when someone who's unvaccinated contracts COVID. Next slide, please. I do want to briefly let you know where we are with Delta. Delta is clearly the dominant strand now, both nationally and in Louisiana. So nationally, Delta is accounting for 58% of all new cases. In Louisiana and our neighboring states, it's 59%. So if you were to be exposed to COVID this afternoon, odds are, more than likely right now, more than 50% chance it would be the Delta variant. When we look at nursing home residents, and this is a graph that we've showed a couple times now, but it really clearly illustrates how effective these vaccines can be when enough people choose to get them. When we look at cases in nursing home residents, they have literally plummeted since we gained broad vaccination coverage. Right now, 85% of nursing home residents across the state have either initiated or completed the vaccine series. That's more than the national average, which the AARP put out is somewhere around 78, 79%. But the protection gained from that coverage is very clear. We have had minimal cases, single digit every week cases in nursing home residents compared to what was really the epicenter of the outbreak. This should show you how well these vaccines work when enough people take them. That's the bottom line. Next slide, please. Because the risk is higher right now in Louisiana, I want to come back to some recommendations that are still in effect and some recommendations that we will now revise a little bit. Since the CDC revised their national masking recommendations, since that point, it has been the clear public health consensus recommendation that if you are not yet fully vaccinated, meaning if you're unvaccinated completely or if you're not yet 14 days out from completing your series, that you yourself mask and distance, particularly when you're indoors and around other people. That is for your protection and for the protection of everyone around you. That recommendation certainly does not change. What we will add now, because we are now in a surge and the risk is now higher, if you are fully vaccinated and you yourself are at increased risk of complications because of advanced age or underlying condition, if you live with somebody who is at an increased risk of complications, or if you just want extra protection, you should now also consider masking and distancing, particularly when you're indoors and around other people. We need to be changing our framework right now and realizing that while we were in a relatively low-risk environment a month ago, even 2 or 3 weeks ago, we are not now. We are in the middle of a surge right now. The risk is higher to everyone in Louisiana, and I think families should take a step back, take stock of what their own risk is, and discuss how they want to best mitigate through this. Thank you very much for listening. I do hope that people strongly consider, to say the least, getting vaccinated if they've not. If you have already gotten vaccinated, please reach out to those around you and encourage them to do so. It will increase your safety as well, and it very well might save a life. Governor?
Thank you, Joe, and Dr. O'Neill, and thank you, Tyler, as well. We appreciate all of you. I forgot to ask you to ask questions of them as they were up here. So when we get to questions in a minute, if you have questions for any of the presenters today, you'll be able to do that. So if it sounds like, I'm not going to characterize Tyler, but if it sounds like Dr. O'Neill and Dr. Canner and I are a little bit frustrated, it is because we are. We're frustrated because we've lost 4 months of progress in reducing COVID hospitalizations. Frustrated because for so long, all we had were mitigation measures to slow the spread. And now we actually have medical measures that actually protect people and slow transmission. But people are still getting sick. People are still being hospitalized. People are still dying. And it is more than 90% preventable. And, you know, there's almost 1.7 million Louisianans who have made the right decision to be vaccinated. And I thank them, but it's not enough. So we have to do more. And one thing I can assure you is, Dr. O'Neill, Dr. Canner, we're not giving up. We're going to fight every single day. And we are also clear-eyed that while we believe the message is extremely compelling and supported by all the evidence, all the data that you just saw, we know that there are individuals out there who, for whatever reason, are very reluctant. And it is a choice. But we're encouraging people to make the correct choice, an informed choice. And so if nothing that you've seen today, if nothing that you've heard today spurs you to go out and get vaccinated, and I hope it will, by the way, I hope you get vaccinated today, please talk to your doctor. Get with a medical professional, ask your questions and get them answered. And for those of you who have been vaccinated, I'm going to ask you to be an ambassador for the vaccination program. You've done your part to protect yourself and your family and your community. Ask others in your family and in your community that you feel comfortable doing so to be vaccinated and become an ambassador for that program. I think we're at 10,828 deaths today. Is that right? Y'all think about that. 10,828. And it's been since sometime in March of 2020 that we had a daily report with nobody dying. Clearly, we can do better. We must do better. All right, with that, we will take a few questions.
you tell us at what point you think that you may consider putting any more regulations or mandates in place?
Yeah, well, that's a great question. And clearly, the difference now and previously when we had various mandates and mitigation measures in place is the availability of vaccine, not just available in small numbers and in a few locations, but all the vaccine that we need in more than 1,400 locations. That is what we are focused on right now. And you know, I'm hopeful that as people see this information and understand where we're headed, not just as a state, but as a country, that they will make the decision to be vaccinated. But at the moment, I am not considering reimposing any mitigation measures or mandates. Now, we will obviously continue to look at the numbers over time, but we're just not there yet. Yes, ma'am. Dr. O'Neill, come on up.
I know you mentioned you have kids. I don't know how old they are, but we all know that children 12 and under can't get vaccinated. If, as a parent, if your kid's in summer camp or, you know, in a couple weeks they'll be in school, do you think kids 12 and under should be wearing masks in those types of settings?
I'm going to try not to take up too much of your time, but we stood 5 feet inside of Winn-Dixie about 2 weeks ago, all of my kids and I, and my son, who's the only one under 12, and so he's the only non-vaccinated, threw a fit that he had to put on a mask because none of us did. And his sisters gave him just heck about it. The fact that we're picking on each other about who's fully vaccinated in our house is a terrible thing, but also something that we've held to. My son's a loud talker. He likes to pick his nose, right? And he's not vaccinated. And so for me, a month ago, you know, did I feel comfortable putting my kids in camps? Absolutely. Do I tell my kids to wear their mask? Absolutely. Do they hate it? Yes, they hate it. But they got to go to camp this summer, and that was a gift. So yes, unvaccinated people should wear their masks, just like Dr. Cantor talked about. Will it be hard? Yes. Do I hope for approval for his age group? Very soon, yes. If they have clinical trials that open in this town, the O'Neills will be lining up so that he can get a chance to get the vaccine. But we have to do this. It's just not safe, and I don't want my child to get COVID. I didn't want anybody's child to get COVID and be admitted. And I think that's the message today. Thank you for that question.
Thank you. Yes, sir.
This might be a question for Dr. Cantor. You know, now that we're in a surge, and what's different now is there's this mass of people who are vaccinated. I mean, what, I guess, advice would you give to someone who is vaccinated if they're exposed to someone with COVID, or, you know, should you wear masks to be, if you want to be more careful and help stop the spread, or, I mean, what advice would you give to vaccinated people?
Thanks. A very fair question, and thank you for it. So the question was, what advice is appropriate for people who are fully vaccinated and wondering what should they do now? And you know, I think the first step is to do a risk assessment. You know, ask yourself, am I at increased risk of complications of COVID? You know, am I getting older in age? Do I have underlying conditions? Do I live with someone who is? And then even if the answer is no to those questions, what's my tolerance for risk personally? Do I want to be as well protected as possible? If the answer to those questions is yes, then I think because we are in a surge now, it would be prudent for individuals who are fully vaccinated but at increased risk or want more protection to first try and avoid crowded indoor spaces. You know, if you're shoulder to shoulder with a lot of people, that's a high risk transmission environment. I think because we're in a surge, if you can't always, but if you can, avoid those spaces. If you can't, I do think wearing a mask and distancing as best you can is good advice right now. You know, particularly when you're real cramped in indoors. That's where this virus spreads easiest. If you are fully vaccinated and not at high risk and you don't want to or it's not worth it to you to take the extra precautions, I think that's relatively acceptable too. But again, it comes down to our personal risk analysis and how much risk you're comfortable with. I'll tell you, neighbors of mine and colleagues of mine who are in increased risk for complications of COVID and fully vaccinated, I've recommended to them, just like I said a few minutes ago, when you're in crowded indoor spaces while we're surging, it makes sense to mask and distance if you can't avoid those situations altogether.
What are your thoughts on booster shots? Are there any plans for any coming up, or should people be looking to get a booster shot soon?
Nothing is really fit to print right now. I do think booster shots will be a part of life for a lot of people down the road. We don't know exactly how far down the road that's going to be. What's happened to date is some of the vaccine producers like Pfizer have looked at their own data. They've looked at, Pfizer has a lot of data out of Israel, for example, and they've met with officials from the White House and the CDC to review that data. And I do think a recommendation will be coming down the road, perhaps sooner than later. I really don't know more than that. It's a possibility that it won't be a blanket recommendation for everyone, but it would be tailored to people who are above a certain age or people who have weakened immune systems because they're on immunosuppressants or cancer patients or so forth. It's possible it might be tailored to certain risk categories of individuals, but we're going to have to wait and see. Right now, booster shots are not recommended for anyone. We do think that's going to change at some point, and the CDC is actually meeting on the 22nd of this coming week to talk a little bit more about that. So further news might come, but right now there is no recommendation for booster shots. Yeah. Yeah.
My question's really for anyone that wants it, but there's this line of thought out there that if you haven't gotten the vaccine already, you're likely not going to get it, no matter how much data we put in front of you or how much advocating people do. So, I mean, what's the level of concern that y'all have that this is going to continue to become a grave situation, maybe similar to what we saw last year, or is there some hope that we will actually reach the levels of vaccination that y'all would like to see?
I really disagree with the first part of that. I am hopeful that we're going to get to where we need to be. It's just taking longer than I think anyone here is comfortable with. But to the first part, I think there's probably a smaller segment, a vocal segment, don't get me wrong, but a smaller segment of folks out there who have dug in their heels, for one reason or another. But beyond them, there is a large movable middle here of individuals who likely will get vaccinated at some point. They're just not there yet. They remain on the fence and they have questions or concerns. And those are the folks that I think we need to be doubling our efforts to. We continue to have between 2,000 and 4,000 new vaccines initiated every day. And that number, had been going down before the law year was announced, and now it's kind of leveled off. So that we continue to have people, every day, now we're 7-8 months into the vaccine campaign, get vaccinated. So there are people out there, and I think there's a lot more than people realize. It's just not the loudest of voices. I'll promise you this, and just like the governor said, we not only are we not giving up, and we are working harder and harder every day to find what would be meaningful to someone, trying to reach people where they're at, try and get questions answered, try and partner with organizations that might have more street cred than government does, and do whatever we can to reach those people. I really do look at this in terms of lives being on the line. And I do think that there remains a lot of people that will get vaccinated, that you just haven't gotten there yet, and therein lies the opportunity for us. Thanks. Yeah, last question. The governor.
Melinda, before I take your question, just a little bit on the last question. So we're not going to concentrate only on those people that we believe are in the unvaccinated category who are more amenable to receiving a vaccine. Because people who have said they're absolutely not going to do it, they said that based on something. Some knowledge that probably was informed by misinformation. And some appreciation of the danger for COVID that probably wasn't accurate then, but it certainly isn't it certainly isn't accurate today. And so we're going to continue to furnish the best, most reliable information that we can to everyone. And no matter how intransigent they may seem, because I think we have to do this. This is about public safety. This is about saving lives. And there's nothing more tragic than when you see that someone who was just very animated in their opposition to mitigation measures and to mandates, and who were so dismissive of COVID and they're dismissive of the vaccine, that they contract COVID, to go into the hospital. They either have a very serious case or they die, and then the next thing you know, their family and friends are saying, well, this really is real. There's nothing gratifying about that. There's nothing that causes us to take some delight in saying, see, we told you so. That is a very painful experience, and it's happening all the time. And it's one of the things that's wearing on these medical professionals every single day. And anyway, we're never going to give up on any segment of our population, no matter what reason they assign for not being vaccinated. We're going to keep working hard. Melinda?
Governor, two questions. One, could you talk about the numbers you've seen in terms of the lottery? It doesn't seem to have driven vaccination rates very much, so I'm wondering if you're disappointed by the numbers that you've seen so far. And then also, I was wondering if you could comment on the legislature's announcement this morning that there will indeed be a veto session.
Sure. So I am very confident that the number of people vaccinated today is appreciably higher than it would have been absent the lottery. And, you know, it's impossible to know how many people who've been vaccinated since we made the lottery announcement who would not have otherwise been vaccinated. But what we can know with some precision is the trajectory that we were on, which was steeply downward. And since we made the announcement, that has leveled off. And so if you take that difference, it is easy to conclude and correctly conclude that the lottery has caused more people to choose to be vaccinated. And it's my hope that it doesn't just cause more people to be vaccinated, it causes more families, more friends, more coworkers to have these discussions about vaccination, and it spurs people to get their questions answered, so that over time, it's not just the direct impact of the lottery. The lottery is part of our outreach and education campaign, and I believe that it is being successful in that regard. Again, nobody's ever going to be able to give you a precise number, but if you look at where we were headed and the trajectory we're currently on, things have improved. And I will remind you that you can get vaccinated today, and you have until 11:59 to sign up for next week's drawing. With respect to the legislature's announcement, it obviously is no surprise. We'll have a session that'll start on the 20th. It can go up to 5 days, and we will see which, if any, of my vetoes will be sustained or overridden. There is a difference between the majority in the House and the Senate that are required in order to call themselves into an override session, and a 2/3 vote needed in both in order to actually override a veto. The vetoes that I issued, I fully stand behind. I will direct you to the veto message that I issued, and they fully explain the rationale for all of those. All of those vetoes were in the state's interest, in my estimation, and I stand by those, and we'll see what happens next week. Yes.
With this being the first, I guess, ever veto session, Are you concerned about a log jam and you not being able to get your policies through with both houses voting to go into a veto session?
No.
What your long-term?
No. First of all, it is part of the process that is spelled out in the Constitution. But at the end of the day, there is a big difference between the majority required to come in and the 2/3 required to actually override. And if you look at the totality of the work done this session, when it came to raises for school teachers and better funding for higher education, when you look at the assistance that we're able to provide through the American Rescue Plan investments that we're going to make in water and in sewer and in broadband internet, when you look at all the protections that we've conferred upon students in higher education with respect to sexual harassment and assault and all of those sorts of things, and the myriad of things that we were able to do, I feel very good about the session overall, and not just the ability to deliver this year, but going forward for the rest of the term. You know, and again, there's not a veto that I issued that I don't fully stand behind for the reasons set forth in the veto letters. And so we'll see what happens next week. It'll be interesting, but at the end of the day, if you look at the totality of the session, the number of bills that were actually sent to me, signed and vetoed and so forth, you'll see that the overwhelming majority of the work is being done in full cooperation between me and the House and the Senate and the leadership and so forth. So I don't have that concern. We got one more, and I can go back here, but it's going to be his third or fourth question. But okay, go ahead.
I just want to go back to the COVID situation. We have a big game. Tigers have a big game coming up in California, Los Angeles County, where they have mandates in place back.
Yeah.
Restore mandates. Plus, they're talking about avoiding travel. Californians avoiding travel to Louisiana. I know it's early, but do you think this may have an impact? Have you been in contact with the folks out there?
I think you sort of answered the question. It's too early to know because the game is scheduled in early September. It is the middle of July. I don't think we can know right now. It's scheduled. It's going to be held in Los Angeles, and I know an awful lot of people intend to travel, and it's my hope that will be possible. But I will encourage everyone to be vaccinated because that's how we make sure that not only is LSU football possible, but all of the things that we want to engage in, whether it's travel or events or activities or work or whatever. I mean, this is the key to everything. And I like you bringing up LSU football because this time of year, that's what people start looking towards and are most excited about. And I'm still hopeful and optimistic that we're going to be able to safely fill Tiger Stadium. I would tell you that would be a very dubious proposition today. But we've got time to make considerable improvement. Look, thank you all for continuing to cover this. I want to thank the people of Louisiana again for taking this seriously to the extent that the individuals have. And I want to appeal one last time today, not one last time period, but one last time today, for individuals who have not yet been vaccinated to do that. It's a safe, effective vaccine. And I want to, I don't have the slide up yet. Go back and look at that nursing home slide. 85% of our nursing home residents are fully vaccinated. 85%. These are older people, almost all of whom have comorbid health conditions that predispose them to worse outcomes, and they live in a congregate setting. This is the trifecta that made nursing homes the epicenter of the first surge that produced all of those calamitous results. And you see how safe and effective these vaccines are, even against the Delta variant, because we have almost no cases in our nursing homes. So anybody out there who still doubts the safety and the efficacy of these vaccines, look at that slide. And just know that if we can get to somewhere like 85% across the state, how much better off we're going to be, how much less death we're going to experience, how many fewer people get sick and hospitalized, the load that's going to be taken off of our healthcare professionals. We can do this. We've got to do it. I think we're going to do it. But boy, it's painfully slow. Thank you.
Are on inclusion,
You see so many pictures of men winning.
on social justice,
These objects were stolen. They were never intended to be in a space like the Met.
The museum has had to retreat. Now it's trying to come back and wants to come back with what face?
when the world unlocks